Dr. Cole. I'm excited to next introduce our keynote speaker, Dr. Vohra, who's the director of the Illinois Department of Public Health. Dr. Vohra was appointed as the director of the IDPH in August of 2022 by Governor J.B. Pritzker. Dr. Vohra is a general pediatrician who holds degrees in law and public policy. He's a cross-disciplinary leader in the state and national health policy formulation. Prior to his appointment, Dr. Vohra was the founding chair of the Department of Population Sciences and Policy, a practicing primary care pediatrician, and an associate professor of pediatrics, public health, medical humanities, and law at the Southern Illinois University School of Medicine in Springfield, where he also served the state of Illinois as interim chair of the Children's Mental Health Partnership. Dr. Vohra has strong ties to the University of Chicago, where he earned a Master's of Arts in Public Policy, completed his pediatrics residency. We're thrilled to have him here today to speak on the state of Illinois' adolescent health and Illinois Department of Public Health updates.
Well, thanks so much, Dr. Vohra for that introduction. And what a pleasure to be back here at the University of Chicago, see some friends in the audience. And it's always a thrill to be invited here. And thank you, Dr. Wong, for the invitation to really talk about something that at my core is something that has always driven me in medicine, in public health. How do we think about the present and future state of our children? Now is not an easy time to be a child in the world, in the United States. And much of it has also been right here in the state of Illinois, right here in the city of Chicago, all the way down to deep southern Illinois and everywhere in between. Our children are facing challenges in ways that they've never experienced. And us as policymakers are also being confronted with new challenges on how we do the things that are necessary to build the right futures for them. So what I hope to do over the course of my presentation is to kind of go through a little bit about the state of Illinois' adolescent. I'm gonna talk a little bit about my own personal journey, the way that I have linked physical health, mental health throughout my career, but also to think through how a lot of my different experiences have made the future of our children the core foundational principle about how I view public health. We are here at a chronic disease symposium, but really frame the idea of children and adolescents' mental health as a true sort of chronic disease. One that has gotten so much attention during the pandemic, but we knew was a crisis before it. And then also playing how certain chronic diseases of our society are also making the chronic diseases of our children more troublesome. And then talk to you about how the state of Illinois, led by our governor, Governor Pritzker, has really prioritized children's mental health as a core principle in the work that is being done by leaders, not just in the Department of Public Health, but really across government. And finally, if you'll oblige me, I do want to sort of talk to you about how we're thinking about the future of public health in Illinois post-COVID-19 public health emergency. And just coming in at the end of Dr. Cole's presentation, how we do the right investments in systems moving forward so we're better prepared for future public health emergencies by making sure that we're investing in the systems that matter. So this is Whitney Houston, and you know, Whitney Houston has been in my head a lot this past week. And I had a really incredible opportunity at the end of last week to be at a convening with President Clinton and President Bush. And in that conversation with a whole host of leaders across the country, President Clinton said a statement there that made me think of Whitney Houston. But made me think of Whitney Houston because of how children are our future. And when President Clinton said that one of his core governing philosophies was, were the policies that we were making allowing our children to be better prepared for the future and more able to live the kind of life that they wanted to have in the future by the policy decisions that were made. Now, a little bit of, you know, a preview into the complicated things in my mind, this is what comes through. Then this song, which you'd probably kick me out if I start trying to sing. But just that idea that I believe the children are our future, teach them well, and let them lead. Right? It is so simple, and I'm sorry that I'm sure this song will be in your head the rest of the day as well. But hearing President Clinton say that, it made me think of where my career started, right? On this idea that if we were doing the right things to protect the dreams of our children, when we were doing the right thing in our medical care, in our public health priorities, but also how we were investing in making decisions in public policy. Now, I've had the honor and privilege of being the public health director now for a little over 15 months. These are not always the decisions that are the guiding principles that are used to make public policy, right? Children don't vote. We often sort of think about complicated ways in which we make the decisions that govern our efforts. But at the core, there's a simplicity to this that really should, and in the right way, could resonate as the foundational principle on how we make the right policy level decisions. And for me, being a pediatrician, and then as Dr. Bowen-Weezer said, you know, all the other degrees that came through my long education with therapy, it was that if we started and created and invested in our children, that meant that we had to invest, and Dr. Palm was going, we had to strengthen our families, right? We had to invest in communities, and we had to then build the systems that were thinking about those things along the way. And in order for a child's dreams to be protected, we had to prevent them, and often the universe that surrounded them, to be plagued or troubled by this. Now, what is the core of public health? Prevention of disease. Public health, I know in this room, I'm preaching to the choir a bit, but that what has public health become over the last 3 years? It's been COVID-19, vaccination, masks. But at the heart for me, public health was always about prevention and community. Building the type of community that we would need to be healthy enough to lead the lives that we needed to lead. That meant that we had structures in place, that we had the right medical care, the right access to nutrition, the ability to make sure that in every single segment across the continuum, we were doing the things that mattered. And so it never felt like a pivot to go from pediatrics to public health. And it never felt like a pivot to understand that throughout this educational journey for me, that whether it was here in the city of Chicago, on the north side or on the south side, whether it was in deep southern Illinois, or now at the Illinois State Health Department, is that at that core, it doesn't matter where you're in Illinois you are, we all need that dedication and that opportunity to make sure that we invest in our children. And part of it, as many in this group know, right? We are often situated that we think about our medical care, or even how we think about care in general based on how care is funded. And I'll go into a little bit of that later. But part of that has also separated our holistic ability to think about our health, because we separated by ICD-10 code, grant opportunity, and not to say that this is one holistic person or family, which allows us to make often conflicting decisions as we try to build the right system. And that's very much the truth of many of our bureaucratic agencies. So I have a line that says I can spend all this money on HIV, but I can't spend it around diabetes. But there might be things that if we could figure out how to raise that funding, we could make and uplift all of those folks. Our state public health department was infused with federal money based around COVID-19. But were we really able to shift the system in a way that needed for long-range sustainability? I'll give you the newsflash, no. But how can we sort of create the right trajectory moving forward under the leadership of this governor, and to very much feel benefited and lucky to be in a state with leadership that really cares about public. Because ultimately, and there's more here, right? It's not physical, mental, it's also social, emotional, environmental, that all of our components of health come together. But if we are constantly separated in the levers of how we do business, then we got to understand how to get to a place where we are thinking about health holistically. A more unified vision in how we see the practice of our health. We start with public health and healthcare delivery, but all the things in between that are necessary to make that. And so it was mentioned that right before I took on this role, I got a really unique opportunity to run the Illinois Children's Mental Health Partnership. And the Illinois Children's Mental Health Partnership, created back in 2003, to think about a public health concept and how we think about children's mental health. And I would say that we know that there are so many challenges right now around children's mental health, but it's often not thought through a public health lens, because we know how hard and difficult the treatment aspect of this work is, and it generates all of the oxygen and attention, and in many ways rightfully so, right? People that are coming to hospital healthcare facilities needing opportunities to get care. But there's little opportunity to sort of talk about the prevention aspect. Things that I do think many of us want to think. How do we partner and move forward in meaningful ways? And I'd say this opportunity with the Illinois Children's Mental Health Partnership, and a plan that was created, the first comprehensive children's mental health plan in the state, nearly 17 years back in 2022, provided the right sort of, let's say, inspiration for me to take on more challenging opportunities and to lead the state's public health department. So let's start here. Our chronic disease challenge of our adolescents. As we said, man, it's a hard time to be here. You know, I have two young daughters 9 and 6. And even just the fact of questions that I get on a day-to-day basis, that I can't even imagine having similar thoughts at that age, years ago, right? The constant influx of information, even before they're exposed to these. And that idea of what is really at their disposal, and the fact that, and I would just often hear from my patients, often my adolescent patients who are struggling, often with the idea that we used to live in a world where, yes, bullying happened, people got picked on, but that was a moment in time that maybe the people in that room witnessed. And for all of us, many of the adults in that room, that in itself was earth-shattering. And now to be able to be constantly played on loop, created into a meme, while also knowing, and we'll get into this later too, the addictive properties of social media that keep making people go back, including all of us, right? Who, as my weekly updates continue to remind me how much time that I'm spending on my phone each and every week, right? And we know that it challenges children's mental health. And we know that it's also leading to the worst aspects of challenges in terms of mental health leading to suicide. Here's kind of a map of Illinois that our department kind of put together, mortality rate per 100,000 from 8 years for adolescents 15 to 24. And we see certain pockets of our suicide rates continuing to grow, and we see certain areas with large kind of growing challenges. We also know that a lot of the core of this is this idea of adverse childhood experiences. And to an audience like this, adverse childhood experiences is not a new thing. But we all know the original kind of landmark study, Kaiser Permanente, and the CDC that said, if children had one of these adverse childhood experiences during their youth, that it led to riskier health behaviors, chronic health conditions, lower life potential, and early death. And so that study at that time wasn't even linked to dosage of the adverse childhood experience, right? It was just the fact that you would have it. And some of those statistics, insane, right? That if you were a male and had 4 or more adverse childhood experiences, your risk of suicide was 30 times more than average. If you had 3 or more, that your risk of risking sort of alcohol dependency was 7 times. And we know that these were sort of serious challenges that played into the types of activities that if we could get to the core of this at a child's youth, we could make monumental, right? We know that has sort of really changed the way that we think about so many things in pediatrics, the way that that's engaged with the school system. But what we haven't figured out yet, so how does this actually apply in real time with the types of policy solutions that are needed? And so we talked about this being a chronic disease. This is some information kind of before the pandemic from the state of mental health in America. Over 1 in 10 youth in the US experience depression that severely impaired their ability to function at school, work, at home, with family, or in their social life. 6.34% of youth in the US reported substance use disorder in the past year. 60% of youth with major depression did not receive any medical health treatment. And nationally, only 28% of severe depression received some consistent treatment. And then just got worse. Right? Many of the support settings that individuals have in school, in community groups, the increasing social isolation, the aspect of social media becoming the source of information on most things, leads to even greater change. And we saw during the pandemic that in 2021, 30% of Illinois high school students and 43% of female high school students reported that their mental health was most of the time or always not good. Most of the time or always not good, right? How do we get to a spot where those things are put in place? And as we see in this graph, a number of adverse childhood experiences really creating the types of issues and problems that we make the well and the deeper and deeper around how our children are ready to. And this led to one of a kind, first time in our history, the Surgeon General having an advisory in 2021 around youth mental health, and just in summer of this year, having an advisory around social media and youth and mental health. Reaching every aspect and the highest levels of government, how much of a problem this is for our youth. And so then if we think about the chronic disease challenges of our society, we know that there are also a whole bunch of other items that are just making our mental health challenges worse. Gun violence. Now we could do a whole talk on this, but we'll mention just a few things here about just how much of a day-to-day sort of constant issue it is for so many of our youth. The challenges around how that plays into the type of safety and security that our children need, and really bring up and move forward some of the challenges around the adverse childhood experiences that I mentioned. And once again, the COVID-19 pandemic contributing to the social and economic stressors associated with increased gun procurement and heightened violence. We know that the opioid epidemic. Another challenge that, of course, affecting our adults, and in a place where we are continuing to see an increase in yearly opioid fatalities, but then also seeing now the relationship with synthetic fentanyl and xylazine, leading to a spot where we are also having synthetic opioid fatalities increase in our youth. And although still relatively small numbers, the fact that we were at 1 and 0, we know that this is something that continues to be a growing concern. And this kind of, as I mentioned, right, that most adolescents who spend more than 3 hours on social media face double the risk of experiencing poor mental health outcomes. Now, if the average then is 3.5 hours of social media use, we know that almost most adolescents are in that range where they're struggling. We know that social media perpetuates of the world that is often not based in reality along a whole bunch of things, but especially for young women and kind of body dissatisfaction. And then we also know just the fact that the great sort of rejuvenator of our health and often our mental health, the ability to have good quality sleep in a way that social media continues to disrupt. So this is all incredibly high level. And of this is to say that the state of Illinois knows that this is a huge problem, and Governor Pritzker has made it a priority of his administration to make an impact around children's mental and behavioral health. And part of it has started with this sort of initiative to create the Children's Behavioral Health Transformation Initiative. Many of you have heard of it. In a real way to connect pieces across government, to first build a blueprint and then set to follow an implementation plan that would allow for a real change in how we do children's mental health across the state. For the first time, human services, children and family services, juvenile justice, healthcare and family services, state board of health, and public health all working together under the leadership of Dr. Dana Weiner to adjust capacity in the system, streamline processes, intervene earlier, increase accountability, and develop agility in the system. Now, part of that just seems like deck shot, but the fact that all of those entities working together around a common cause and the implementation of these 12 goals that include creating a centralized resource for families, improving coordination, creating oversight of residential beds, adjusting rates around reimbursement, increasing capacity, offering universal services, building workforce, and creating community networks. We're excited to see this sort of codified and made into a place where we see impact. And we also are trying to say, through a real energy around our team, to say that well, mental health conversations need to also happen in the Department of Public Health. And we want to launch efforts to work better with our providers, work to find the opportunities with the Illinois chapter of the American Academy of Pediatrics, UIC's Doc Assist, to make sure that we have better training. And we just announced last week $9.5 million to 40 different organizations across the state to innovate in unique ways to strengthen mental health services for youth across Illinois. But then it goes at the core of also making sure that these are not just things that we do around our grant funding, that we're also working on community efforts to make an impact. And the ability to say public health is community, we have to go out back in the community to have the kinds of conversations that are meaningful. And we're fortunate to be a time now where we can actually do that, be in rooms like this and engage in person around these really difficult conversations. And think about that from a society level of how can we as public health be leaders around innovative campaigns to make a difference and educate about things that can help deal with the chronic problems just as much as we can use our funding to move things forward. And so the Firearm Restraining Order Act, which is really creating an opportunity for us to run a public health campaign around firearm awareness. We're working with the governor and the attorney general around next steps in combating the opioid epidemic, with nearly over $1 billion the state has received over a 20-year period to really engage and bring things back to the community to address the epidemic. And this, what you might have just seen last week, we joined 33 states to bring a lawsuit against Meta for business practices that harm children. The state of Illinois is truly trying to lead on a number of levels. Although yes, incredible amount of work still needs to be done, but these are efforts in which we're trying to address the issue at hand. So I have about 2 minutes left, and I'm gonna just sort of go through, well, how is the agency now looking post-pandemic? And I'm gonna go over a few different priorities that start here. That very much with how we're looking at health, that health needs to be a unified vision. a place where not public health is in one corner and healthcare delivery is in another corner. Not the federal government is doing one thing and local government is doing another, but how do we connect across government and across our communities in meaningful ways? How do we make our funding streams, our rules, really allow us to work on a unified person around a unified vision for health? Right now, we know that fragmentation exists. But part of what COVID taught us is that if we're going to move beyond the fragmentation, we have to start thinking together and rethinking the idea that there is a healthcare delivery system and a public health system. And how can we use some opportunities from the federal government to make an impact there? And that means first and foremost, building robust agencies. There's been a lot of push in the public health department itself. And how do we work with universities and all of the talent that is in the state of Illinois to build a modern, resilient agency that is not just built up for an emergency, but one that has the foundational pieces and the partnership to respond to the everyday crisis and then bulk up when needed. How do we start here? Right? That, yes, right? Something very simple, that policy should be evidence-based. But we know that it isn't, right? But part of it is that government isn't often built to create the infrastructure to know that their policies have made it. And building the right kind of policy units within government to make sure that the money that we spend is meaningful, and then create the opportunities to constantly learn and evolve the way that we would want any organization to do so. Or restore the public's trust, right? Just the idea that we know trust has become a challenge. But part of trust means showing up, listening, getting yelled at because you didn't do the best job, but knowing that you want to hear that for feedback to do better the next time. And it means that we have a lot of growing to do in our public health community. There have been a lot of voices that have never been invited to the system to have meaningful engagement, and all of that needs to change. And it began to change around COVID, but now we need to build that into the contours of every aspect of our health structures and really combat the misinformation and disinformation that really is a challenge. Dr. Cole mentioned investing in communities, absolutely. And then thinking about health equity and health justice in ways that allow us to address disparities and make meaningful action. Now, all this will ultimately allow us to prepare for emergencies, and we can create the foundation that we need in the Department of Public Health for the future pandemic. But hopefully, that I can leave the world in a better place for the next set of leaders that may continue to make an impact for the State Department of Public. Because ultimately, this is the goal, right? A healthy Illinois for all of us, especially our children. Let them lead the way. And we can do all of that together. So thanks so much for your time. Happy to answer any questions.
We're going to ask all of our speakers to come up to the front and join us at the table for the panel. I'm going to use the next time frame before lunch really to encourage a conversation among the group.
We want to pass around this microphone.
Or
Yeah,
that sounds great. So for those in the room, go ahead, feel free to raise your hands, keep your hand